discussing your safety practices in the laboratory. So I'll be starting early, so we can finish early as well. Color. Ms. De La Peña, do you have a favorite color?
Yes, sir.
What kind of favorite color?
Color red.
Okay, let's go with red. Now, here's the overview of your safety practices. Now, all users of the bacteriology lab must focus on the need for safety. Class, let me emphasize the statement, must focus on the need for safety. I have a question. Why do you think you need to focus on safety in bacteriology lab? Can anyone tell me? Why do you need to focus on safety in bacteriology lab? Any ideas? Yes, who's raising your hand? Yes, Grass, you're raising your hand. Was it Dean? Dean was also raising her hand.
Yes, sir.
Yes, go.
Since in bacteriology lab we're handling specimens that are possibly pathogenic to humans, sir, so we must practice safety so that in order for us to not be infected and contaminate our surroundings.
So to not get infected and to not spread. Not spread, okay? Any other answers? I saw, was it Figueroa and Gwen? Sorry, class, I'm not able to see everybody kasi na nag-raise ng hand. Was it Gwen or what? Who else? Sino to? Who's raising her hand?
Hi, sir.
Yes, go ahead.
Since we're dealing with biological agents, there is a bacteriology. The best way naman to break the chain of infection is to focus naman sa safety naton as well as sa pag-handle sa agents.
Okay. Now, Ms. Gwen, what type of agents do you usually handle in a bacteriology lab?
Mga microorganisms, sir.
Specifically, what type of microorganisms?
True bacteria.
Okay, you have your bacteria. What else?
Viruses.
Viruses. What else?
Iba naman, sir.
Meron pa. Sige, isama na rin natin. You could also encounter this. Sige, isama na rin natin. Bacteria, viruses, what else? One more. Can anyone help Miss Gwen? Yes, the one raising it. You may speak na lang. No need to raise kasi hindi ko nakikita eh. Yes, Justin. And what else?
Fungi, sir.
Alright, sir, fungi. So these are the three most common microorganisms that you're going to encounter. Now, all your answers are correct. They are actually good explanations, class. Now, remember, since we are medtechs, we tend to handle a lot of specimens, specifically in a bacteriology lab, that are considered highly infectious. Now, since they are infectious, you need to ensure that there is a focus on your safety. You do not want, as Justin said, you do not want the bacteria, the fungi, or the virus going with you at home and having your parents, your brothers, your sisters, and your loved ones getting infected by those organisms. Now, let's look at the other overview. Now, there are a lot of hazards that must be acknowledged and guarded against. Class, can you give me a hazard that can be encountered in a bacteriology lab? Can you give me a hazard? Any ideas? Give me a hazard that you need to guard against in your bacteriology lab. Yes, you may speak. The one raising his or her hand.
Viral cultures, sir.
Alright, so you have your viral cultures. Okay, what else aside from viral cultures? So we can consider also your bacterial cultures. So when you say culture, class, the word culture is to propagate, to allow to grow. Now, since remember, class, you're dealing with live organisms here, specifically your bacteria, your viruses, and your fungi, you need to take guard against them. And another overview, users must be aware that hazards exist. the basic safety precautions associated with them, and how to apply remedies in case of accidents. Class, I have another question. Can you give me a basic safety precaution whenever you're working in a laboratory? What are the basic safety precautions that you have to practice whenever you work in a laboratory, class? Yes? Yes, Dean, go. Dean, Drizella, and go.
Proper hand washing, sir.
All right, we have your proper hand washing. What else? Speak yung nag-raise ng hand, go.
Wearing complete and proper PPE, sir.
Okay, we have your complete and proper PPE. What else? Yes, you may speak, go. What else, class? Proper hand washing, PPE. Okay, I have another question. If you enter your laboratory class, what's the first thing that you check? So imagine ito yung pinto. This is the door. We have your table here. Then there could be some chemicals here. So there's a cabinet here containing chemicals. Then maybe we could have the eye wash area here and the emergency shower. So what's the first thing that you usually check whenever you enter a laboratory? What's the first thing they usually check? Come on, class. Try participating. There are no wrong answers. Come on. I want to hear your opinion, your knowledge on this.
Signages, sir.
Sorry? What?
Ang mga sign.
Okay, signages. Very good. Okay, what else? Yes, no need to raise the hand. Just speak up. Go.
Safety rules, sir.
Okay, safety rules. Very good. Okay, what else?
Exit, sir.
Exits. Okay, very good. Okay, class. This was a topic that was discussed to us a few years ago. Tinanong kami ng prof namin, what is the first thing they usually check in a laboratory? Now, class, do you agree that the most common incidents or accident that could happen in a laboratory is your splashes? Yes or no? Splashes with chemicals, with do you agree na that is the most common type of accident or problem you may encounter in a laboratory? Yes or no? Ano sa tingin niyo, class?
Yes, sir.
Okay, yes. Kasi 'di ba, remember most tayo sa medtech, we always 90% of the time we will be handling body fluids, reagents and samples. So sabi sa amin nung medtech na na prof na yun, sabi niya, she told us that the first thing you need to always check whenever you enter the laboratory is your eye wash. The eye wash location and the emergency shower. Now imagine this, class. If you're working in the lab, then all of a sudden you get splashed in the eyes. So when you get splashed in the eyes, you have limited vision. So imagine if you don't know the location of the eye shower and wala kang kasama sa lab, you're alone. You will have a difficult problem. Finding the emergency shower. So the first thing, whenever you enter the lab, is always to check for the location of your eye shower and your emergency shower. But these are also good answers. The signages, the safety signs, the exits. You also remember the chemical location. Then another one would be your fire extinguisher, kung saan siya nakalagay. Okay? Then we have your body contact, specifically hand contact, is the primary mode of infectious transmission. Last question, what's the most important PPE based on this statement?
Gloves, sir.
All right, very good. It's your gloves. Now let's proceed now to your color coding in waste disposal. So you will be using a lot of trash bags or trash bins in the laboratory. Now, even in daily lives, we use a lot of different types of trash bags. Now, the yellow trash bag, this is used for your infectious or pathological specimen. Class, can you give me an example of an infectious or pathological specimen that can be thrown in a yellow trash bin? Example, class.
Blood, sir.
Okay, blood. What else?
Body fluid, sir.
Okay, body fluid. What else?
Tissue, sir.
Okay, tissues. Okay. What else?
Bacterial culture, sir.
Okay, you have your cultures. Now, I have another question. Give me an infectious and pathological non-specimen, hindi siya specimen class. That should be thrown in a yellow bag.
Specimen cup, sir.
Specimen cup. Okay, what else? No need to raise the hand, just pick. What else? Specimen cup.
Gloves.
Gloves. Okay, very good. What else?
Masks.
Okay, mask. Aside from mask, what else?
Applicator Phoenix cotton, sir.
Okay, applicator, cotton. Okay. These are all good and correct answers, class. Now, I want you to remember a single rule whenever you're handling infectious or pathological specimens or any specimen. Now, remember this rule. Any specimen, you must consider, always consider as infectious. Whether yung specimen class is galing sa parents nyo, sa boyfriend nyo, sa family relative nyo, you will always need to consider those specimen as infectious. The reason for that, class, is you do not know the microscopic or rather the molecular possibility na kung anong sakit ang meron dun sa sample na yon. So hindi mo masabi, class, malay mo meron pala sa blood niya, merong Hep B. May ganun kami sa case before, class. Confident siya sa boyfriend niya kasi yung sample. Yan pala, hindi siya nag-gloves. Ngayon, nag-break yung sample doon sa centrifuge. Now, trinay niya ngayong linisin, nagkaroon siya ng abrasion sa hands niya habang nililinis niya. And thank God naman, she did not get infected with the HIV na meron yung ano niya. So, yan. Always remember, in the laboratory class, whenever you work in the future, pag interns na kayo, to treat all specimens as infectious. Then we have your puncture-proof container in red trash bag. Please ignore this. This is wrong. Sorry. This is a typographical error. Kindly replace. I'll be replacing this with sharps. So normally, class, you will throw or dispose your sharps in a puncture-proof container. But do not forget, they are placed in a red trash bag. Now, the purpose for the red trash bag, this is a highly symbol of danger. Class. And then you have to put it in a puncture-proof container. Now, a few years ago sa Cebu, class, merong garbage collector. The person was working in a dump site. So nagpupulot siya ng mga ano. Now, one of the waste bins or the trash bags na inano niya was in a yellow bag. So habang hinawakan niya, bigla siyang na-puncture siya. And then unfortunately, the person got infected with hepatitis B. So remember, class, it should be in a puncture-proof container in a red trash bag. Then next, you have your black for your dry waste and non-infectious. Your green for your wet waste that is non-infectious. Class, who here segregates their trash? Sino dito nagsasegregate, class, sa inyo? Yes, John. Do you segregate?
Yes, sir, because recently I'm na ang sa balay.
Okay, that's good. Very good. How about the others? May nagsisegregate pa sa inyo? Alam niyo, class, one of the big problems dito sa Pilipinas is that most Filipinos do not segregate. If I recall, one of my students before na nag-aaral din dyan sa Sanag, meron daw rule sa city na may araw lang ng collection for your dry and wet waste. Pero in the end pa rin ata parang nagmi-mix pa rin. Even here in Manila, class, ganyan din. And sadly, kahit kami dito sa bahay, hindi na kami nakakapag-segregate ng trash. So remember, class, your black trash bag for your dry waste that is non-infectious, while your green will be your wet waste or non-infectious. So wet waste, classes are commonly food. Fruit peelings, and any easily degraded or decomposed substances or materials. Then another would be your yellow with a black band. So this is for your chemicals. So we have a yellow trash bag. So imagine this is your trash bag. So apologies for the very weak and messy drawing. And then it should have a black band. So a black band. That would be for your chemicals. Then we have your orange or for your radioactive waste class. Class, where do you usually find this in the laboratory? Or in the hospital? Where do you find your radioactive waste in the hospital? Hospital, I'm talking about the hospital. What department?
Radiology department.
Okay, so sa X-ray. Now, here's a trivia class. What department involving medtechs can you see radioactive waste? Can anyone tell me? What department involving medtechs can you see radioactive waste? Okay, I'll give you a clue. It's two words. The first word starts with the letter M. Okay, I'm giving you another clue. The second word will start with the letter M. So first word is N, the second word is M. So what department involving medtechs can you see radioactive waste?
Nuclear medicine, sir.
All right, very good. It's your nuclear medicine waste. So your nuclear med class, this is where in medtechs would handle what we call isotopes. Now, these isotopes are usually attached to certain cells. Then they could be used as markers for diseases. Usually, class, pag nag-work ka ng ganito, this is one of the departments na rarely pinapasok ng medtech, but the pay is good. But you have to understand, these isotopes are usually prepared by using certain levels of radiation. Now, I have a question, class. What disease would come to you or could occur to you if you are exposed to radiation? Anong tawag sa sakit na yun? Kapag na-expose ka sa radiation, class, what do you call that disease? Kahit ako ayaw ko yung sakit na yun. What is that disease that could occur to you if you are constantly exposed to radiation?
Is it cancer?
Yes, it's cancer. Very good. So, when you're exposed with constant or daily amounts of radiation, you get to have cancer. So, what the medtechs or those working with radioactive substances or waste, they would ingest iodine. Iodine class. This iodine helps reduces the effect of radiation sa body natin. Alright? So that's that. Next, let's proceed. Now, we have your biosafety versus biosecurity. Class, when you hear the word biosafety, what comes into your mind? Biosafety. Can anyone tell me what's biosafety? Any idea? Opinion?
Safety, sir, it's from the name itself. It's safety from biological hazards, sir.
Okay, very good. So biosafety is protecting humans from the pathologic agent. So let's say you're handling highly infectious disease or organisms such as your MTB or your Mycobacterium tuberculosis. So this causes TB. This is highly infectious. So you need to protect yourself from this pathologic agent. So that's biosafety, protecting oneself from any pathological agent. Now, how about biosecurity?
This one's the other way around, sir.
Okay.
You protect the pathological agent from humans.
All right, very good, good. So it's protecting the pathologic agent from humans. Now, whenever you hear biosecurity class, you would relate this with bioterrorism. Bioterrorism. Now, can you give me an example of an etiological agent that can be related to bioterrorism? So when you say bioterrorism, you're using organisms to kill, to cause terror, to cause destruction among the populace. So bioterrorism. Give me an example of an agent. It can be a bacteria, it can be a virus, it can even be a fungi. Now, can you give an example, class?
Plagues are like Yersinia pestis.
Okay, so we have your plague or your black death, also known as your black death. Oh my God, black death or your plague. What else aside from your plague or your black death?
Bacillus atlantis.
Okay, your Bacillus anthracis. Good job for the both of you answering. Okay, Bacillus anthracis causes what? Okay, it's your anthrax. Okay, what else? Sige, wait lang class. Think it through. I'm just gonna get a better mouse. Wait lang. But there's no note. Okay, I'm back. So what else aside from your plague or black death caused by Y. pestis and also anthrax? What else, class?
COVID-19, sir.
Okay, yes, we can include COVID-19 as well, but there's no known research that it was used for bioterrorism, but it can be used. Malay pala natin, class, nung sinadya pala yan talaga ng China. not to be xenophobic or anything or racist, but let's just ano lang, if worse comes to worse, sinadya pala nila talagang ilik yun or gawin. So we don't know. What else?
Ebola.
Alright, very good. It's your Ebola. You can actually Ebola class. So your Black Death class, also known as your plague caused by your Yersinia pestis, during a period known as the Dark Age. In Dark Age class, it was a period wherein medieval period, wherein rats were a common sightage. The reason why bakit madaming rats noon class because the certain belief of the Catholic Church during that time was that cats were considered some sort of related to witches. So during those times, pinagpapapatay nila yung pusa. So obviously, with the lack of predators for the rats, they would increase, spreading Yersinia pestis, causing your Black Death. So it caused a big amount of death sa populace sa Europe. Then you also have your anthrax. Now, your anthrax class, there was an anthrax scare sa America. I think it was the year 2000 to 2002. I'm not sure on the exact date. So what the terrorists did was they put the anthrax powder in emails. Ini-email nila. As in yung physical mail, rather. The physical mail, then the unsuspected individuals would open it, then they would get infected. Now, Ebola class, there's no known na case na ginamit siya for bioterrorism. But if this is going to be used, this is highly fatal. Now, back in, was it 2014? I think it was 2014, there was the pandemic Ebola cases sa Africa, wherein a lot of people will die. Now, Ebola class, this is a virus that is usually transmitted by sa body fluid. So, imagine yung patient, the one positive for Ebola, would throw up, would have diarrhea, then syempre aalagaan siya, he or she will be taken care by the relatives. Now, the relatives will have to touch the patient, and now the relatives would get infected. The infection or the transmission would always be via the mucous membranes. So, pag hinawakan mo yung mata mo, you touch your eyes, you touch your mouth, you touch your lips, you can get infected with Ebola, causing a fatality, almost instant death in a matter of days. So, nakakatakot siya. So, I hope you understand the definition of biosafety and biosecurity. So when you say biosafety, protecting humans from the pathologic agent, while biosecurity, protecting the pathologic agent from humans. Now, your CTC class classified infectious agents based on their capability to cause disease and its severity. So from low-risk microbes to high-risk microbes. So we have your BSL 1, 2, 3, and 4. BSL meaning biosafety level. So you have biosafety level 1, 2, 3, and 4. 1 being the lowest and 4 being the highest. So let's discuss them one by one. So first is your biosafety level 1. You will handle agents with no known potential for infecting healthy people. So normally class, the organisms involved in BSL1 do not cause disease if you are healthy. But if the person is immunocompromised, when you say immunoclass, that refers to your immune system. Then from the word compromise, it is weakened, damaged, or faulty. So you have a faulty immune system. You could get infected with agents or microorganisms involved in biosafety level 1. Then they are not known to constantly cause disease in adults. So sabi ko nga class, if you're a healthy individual, you would not get infected with it. Then this is the least or the most minimum potential hazard to laboratorians. And you can even perform the work or the laboratory work in an open table. An example would be is your non-pathogenic Escherichia coli, also known as your E. coli 1655. So again, your BSL1 does not cause infection among healthy people, minimum potential hazard to lab workers, and you can even perform work in an open table. A known example is your non-pathogenic E. coli, also known as E. coli 1655. Now, let's look at the safety equipment to wear in handling BSL1. So first, you have your lab coat. So this is your lab coat class. This is a must in any procedure whenever you enter a laboratory. Then your gloves. Then your goggles for your eye protection. So you don't want splashes happening in your eye. And then if you notice, class, the worker here, the lab worker here is doing lab work in an open table. There is no such thing as what you call structural barriers. I will discuss that in the next slide. Ito mga structural barriers na to. Then we have your BSL2, Biosafety Level 2. These are agents that are most commonly encountered in your clinical specimens. They pose moderate hazard to laboratorians. They are typically indigenous. Class, when you hear the word indigenous, these are local, found locally, and associated with a varying severity. Class, give me an example of a very infectious and indigenous disease na meron sa Pilipinas at the moment. Wag COVID, it's not COVID.
Dengue.
Okay, dengue. Yes, what else?
Malaria.
Give me a bacteria, class. Give me a bacteria. That is very indigenous sa area natin ngayon and highly infectious at the moment. So an example would be class is your MTB. So si Mycobacterium tuberculosis na class is mostly indigenous ngayon sa Pilipinas to the point na ang dami nating cases almost It can occur anywhere in the world but at the moment kasi class sa Philippines sobrang taas ng cases ng TB. Then you have the use of your biosafety cabinet. So I was talking about your structural barriers. Now one of those structural barriers include your biosafety cabinet. So an example class of organisms you can handle in BSL2 are your Bacillus anthracis, known to cause your anthrax, your Staph aureus, and your Streptococcus. Class, can you take this down? Your Staph aureus, these are gram-positive cocci in grape, the fruit grape, in grape-like clusters. They are known to cause what you call, they're also known as your flesh-eating bacteria. And then I want you to take note a very dangerous drug-resistant strain of your Staph aureus known as your MRSA, also known as your methicillin, methicillin, methicillin-resistant Staphylococcus aureus. So those getting infected with MRSA tend to have wounds that do not heal. Imagine if you get wounded and then it got infected with MRSA, which is the drug-resistant strain of Staph aureus. Your wound will not heal. It will fester. When I say fester, nabubulok, it will decompose to the point wherein the patient will have to undergo amputation. Then we have your Streptococcus class. Your Streptococcus is found in your nasopharyngeal area. Nasopharyngeal area. They are gram-positive cocci in chains. This is their microscopic appearance in gram stain class. I will discuss your gram stain in the future. So this can commonly cause what you call pneumonia. They can cause pneumonia depending on the species. Okay? Then let's look at the safety equipment to wear in handling BSL-2. So this is the one class. So we have your lab coat, your gloves, your goggles. Then if you take a look, class, when you compare the lab coat with the first picture in BSL-1, you could see that the lab coat is loose. It is not cuff, allowing organisms or bacteria to pass through this hole. But if you look at BSL-2, you could see that the lab gown is covered by the gloves. It is cuffed, preventing your bacteria from entering and spreading into your skin. Then you also have your structural barriers, such as your biosafety cabinet. So this is your biosafety cabinet class. You are gonna work in a biosafety cabinet. So instead na tabletop lang, you now have your BSC and a cuff lab gown. Now let's proceed to your biosafety level 3. Now these are organisms with a potential aerosol transmission. So when you say aerosol transmission, they could be transferred via coughing. And can cause serious or lethal consequences. Requires the use of a fit-tested respirator such as your N95 or your N100. An example of this is your Mycobacterium tuberculosis. So let's give it a brief background. So your MTB class, this can cause what you call tuberculosis. Now the treatment for tuberculosis would last for a very long time, specifically 6 months. So ganyan siya katagal, ganyan siya kahirap gamutin, 6 months. Now, the usual symptoms would be your cough with phlegm, followed by weight loss, sudden weight loss, night sweats, and loss of appetite. So kaya if ma-notice nyo, class, yung mga patients na may TB, ang papayat nila. This is the reason for that. It destroys your immune system. Now let's take a look at the safety equipment worn in handling BSL-3. So you have your lab coat, your gloves, your cuff lab gown, your goggles, your BSC. Then you would notice there is another one. There is a respirator. So you have your fit-tested N95 and N100. So dito class sa picture na to, this guy is using a type of respirator wherein air is being filtered via a machine. So sobrang advanced nito. This can be commonly seen sa outside of the country. That is sa US. But we don't actually do this in a BSL-3 kasi mahal. So ang meron lang madalas is your N95 and N100. So na-notice nyo class from BSL-1, BSL-2, BSL-3, you get an increase in the amount of your PPE as well as other structural requirements. Then the last biosafety level, which is your BSL-4. Now these are the highest risk of life-threatening disease, the highest level of biological safety. Exposure can be fatal and without treatment or vaccines. It requires the full body air supply positive pressures. So class, I want you to take note that this can cause a high lethality, very lethal, leading to your increased mortality. You can possibly die in a matter of hours. So an example of is Ebola, smallpox, SARS, influenza virus, and Marburg virus. Class, napanood nyo na ba yung Resident Evil? Can you consider the T virus as a level 4? Hypothetically, can you consider T virus as a level 4 organism?
Yes, sir.
Okay. It can be, diba? It can cause risk on your life, and it can be fatal. Hypothetically lang naman yung class. If you become a zombie, though. Then this is the appearance class of what you'd be wearing in a BSL-4. So you have your full body air supply pressure suit. Now, this coil here, this is the one supplying your air or your oxygen. The oxygen moves inside that. Then, as you can see, class, everything is highly pressurized. You have to practice this very, very... I've never practiced ng sa BSL-4 class. I think we actually don't have a BSL-4 sa Philippines. Or maybe meron sa RITM, pero I don't think it's like this. Hindi siya ganito ka-strict. So, So very dangerous. You have to be very careful whenever you're performing this type of handling this type of agents. Okay, let's review. A microbiology graduate student is working on a project under the following conditions. Work is done in a table. Non-pathogenic E. coli is used. Minimal PPE is used. What type of analysis is this? BSL?
Level 1, sir.
Alright, sir, BSL1. So no need to raise the hand, ha? You may speak lang. Then select the biosafety level shown in this photo. Okay, it's your BSL3. Very good. How about this one? Work is conducted in a standard lab bench. PPE, including a lab coat, gloves, and eye protection are being used. What? Class, ano? Is it 1, 2, 3, or 4?
1, sir.
Okay, it's 1. Very good. How about this one?
4.
Alright, very good. It's your biosafety level 4. Now, let's proceed to your laboratory safety symbols. But before that, let us differentiate the difference between hazard and risk. Plus, when you hear the word hazard, anong papasok sa isip mo? What comes into your mind when you hear the word hazard?
Source of damage or risk, sir.
So, source of risk. Okay, very good. What else? It's a source of risk. Any other ideas, class, for your hazard?
It has potential, something that has potential to harm.
Potential to harm. Okay, very good. Alright. Any other?
Danger.
Sorry, ano?
Danger.
Danger. Okay. So you have your danger. Very good. Now, hazard anything can be a hazard provided there is an action or event occurring. Plus, I have a question. If you are standing outside in a, let's say, in a busy street at the sidewalk, can standing outside in a busy street be considered a hazard?
Yes.
Yes. Okay. So an example would be you're swimming in the sea, eating in the laboratory. Now, let's take a look at your risk. Now, class, the risk is your likelihood of harm taking place. How great the chance that someone will be harmed by the hazard. So let's go back to what I said. You're standing in a busy street. You're standing in a busy street with a lot of people, a lot of cars. I have a question. What is the likelihood? What is the likelihood of you getting hit? Of you getting hit by a car on a rating of 1 to 5? What is the likelihood of you getting hit by a car if you're standing in a busy street with a lot of people and a lot of cars on a rating of 1 to 5? Can anyone tell me? Come on guys, yung sarili nyong ano, risk rating nyo.
4, sir.
Ano na?
4 for me, sir.
4 for you, okay. How about the rest?
3, sir.
3, sir.
Okay, how about the rest?
3 siguro, sir. It depends man where you're standing.
But, okay, so it's your 3 sa'yo. How about the others?
5.
Okay, 5. Okay.
1, sir.
Okay, 1. Yeah. Okay, what else? Tapos walang maling sagot. Come on.
2, sir.
So, 1. Sino pa? Tingnan natin kung sino may pinakamaraming ano.
3, sir.
3. Okay. Sino pa?
4, sir.
4. Okay. Marami palang nervyosa dito. Kidding. Okay. Sino pa?
3, sir. 3, sir.
3, 2. Okay. 2,
5, sir.
5. Okay. Wala na? Come on. How about the rest?
3, sir.
3.
4, sir.
4. Wala nang 1? So, dalawa na nag-1. Okay, I have a question. Sino yung nag-answer ng 1? Yung dalawa nag-answer ng 1.
Me, sir.
What's your name? Sorry?
Justin, sir.
Justin, do you like to travel?
Ga-travel ako, sir, pabalik-balik Iloilo and Rojas, sir.
Okay. How about the other one who said 1? Sino pa isa nag-1 plus? Okay. How about sa 5? Sino nagsabi ng 5?
Yeah. Ako, sir.
What's your name? Hannah?
Yeah.
Hannah, why did you put 5?
Kaya guys, kasi I like do house every day, may car accident.
Okay. I have a question for you. Are you an introvert?
Depende.
So you're an ambivert. Okay.
Yes.
Okay, class. Here's the trick with this type of questioning. Now, your risk, there's no such thing as wrong answer for your risk assessment. But you have to consider that your rating given, yung binigay yung rating, somewhat depicts on how you handle danger in life. So those, sabi dun sa, those who gave 5 in a situation where you're standing in a sidewalk and there are a lot of cars and tend to be more careful in life. While those who gave a 1 in that situation tend to be more more into risks, more into risks, mahilig sumugal. So yun ang sabi. Justin, is that true? Do you agree with that? Based on your answer?
Depends on what situation, sir, yung kinaistoryan ka sa risks.
Okay, alright. So yun na naman ang sabi niya. So again, class, your hazard can be anything provided that there is an action or event occurring. So swimming in the sea could be a hazard. Eating in the laboratory could be a hazard. Now, following hazard class, there is your likelihood of harm taking place, which is your risk. So an example in those cases of risk of those hazard would be death due to drowning for not knowing how to swim well in the sea, and getting diarrhea while eating in the laboratory. So I hope you understand the difference between your hazard and your risk and how they are related. Okay? Any questions? Clarifications? All right, let's proceed. Now, let's proceed now to your laboratory safety symbols. First would be your flammable sign. So in your flammable sign, there are different flammability rating. So rating 0 will not burn. So an example would that be water. A rating of 1 requires preheating for ignition to occur. It has a flash point. When you say flash point, class, this is the temperature wherein it will explode or it will ignite. Temp where it will explode or ignite. Now, an example would be lube oils and cooking oils. Then a rating of 2 would be can be moderately heated for ignition. Flash point is above 38 degrees centigrade. An example would be your diesel and your fuel. Then another rating 3, ignition occurs at most ambient conditions. So when you say ambient conditions, these are conditions where in normal weather. So flash point below 38 degrees. So anything below it can be as normal as your room temp, which is 25. So an example of that would be your gas and your acetone. Then rating of 4 is your extremely flammable and will readily dispense through the air. So an example of that will be your propane and your butane. And another important thing, class, you have to consider when you use your flammable sign is the fire extinguisher. Now, I want you to remember the word pass. First, you have to pull the pin in the handle. E is for pull. A is for your aim. Aim the nozzle at the base of the fire. And then you have to squeeze the lever slowly. Then sweep from side to side. Again, for the usage of your fire extinguisher, remember the word pass. Pull the pin in the handle, aim it at the base of the fire, squeeze the lever slowly, and sweep from side to side. Then we have your poison sign. So hazards include venom, lead, pesticides, alcohol. Class question. Can you give me a situation wherein lead poisoning can occur? Give me a substance or a situation wherein a person could get lead poisoning. Lead poisoning class. Any ideas? Where can you find lead class in daily usage of in everyday stuff?
In tap water, sir.
Okay.
If may lead pipes ka mo.
Yes, okay. Tap water. Yes, that's possible. What else?
Pencil, sir.
Where?
Pencil.
Pencil. Okay. What else?
Paint.
All right, very good. Paint. Now,
Dust, sir.
what? Sorry, dust. Ano yan?
Dust, sir. Dust, sir.
Okay, so alikabok. It could be, but rarely happens, class. So, nung bata ba kayo, nabibilan ba kayo ng laruan? So, one of those toys, there's a warning always, do not ingest, do not eat, do not ingest due to lead poisoning. So, you can actually get lead poisoning from too much exposure to paint. And itong pencil, you could get this if you're a kid, then kinain mo ng kinain yung lapis. So, around 5 or more pencils would cause you lead poisoning. And yes, tap water, depending on your pipeline, you could get that. Now, class, for your alcohol, what type of alcohol can cause poisoning sa body niyo? The most lethal type of alcohol that can cause instant poisoning. Diba there are 3 types of alcohol? You have your ethanol. The most common 3 types are your ethanol, isopropyl, and your methanol. So which among these 3?
Methanol, sir.
Alright, it's your methanol. So we have what you call your methanol poisoning. So very few amount. Ethanol can also be cause poisoning, but it requires a high amount. But your methanol, this will be discussed in your CC. If I recall, it's around the range of 1 to 3% sa blood, and you could get poisoning. So ganun kababa. And then another will be your radioactive signs. So hazards include your gamma radiation, sunlight, X-rays. Last question. Sa sunlight nyo, type of radiation can cause your disease or disorder?
UV.
Right, so your UV or ultraviolet rays. Now your UV can cause what we call skin cancer. Skin cancer, skin CA. It can be melanoma. Depende sa tolerance, depende sa exposure mo sa UV rays. And X-rays as well. Then we have your biohazard signs. So we've already discussed this. This can include animal waste, contaminated PPE, laboratory agents, such as your bacteria, viruses, and fungi. Then you have your proper hand washing. So I'll show you a video later on how to do this. And we have your nosocomial infection. So when you hear the word nosocomial, what comes into your mind, class? Do you have any idea what the word nosocomial means? What does the word nosocomial mean?
Hospital-acquired infection, sir.
All right, very good. So it's your hospital-acquired infections. Hospital-acquired infections. So these are transmission occurring in healthcare workers, patients, hospital equipment, or interventional procedures. The common cause class is your bacteria. Now, the 5 most frequently acquired infections from clinical laboratories are, let's focus first on the first 2. You have your shigellosis and salmonellosis. Now, we have your Shigella and Salmonella. Now, both of these are transmitted via food and water. There is a type of transmission called your fecal oral route. So that is how it is transmitted. Now, your shigellosis and salmonellosis are known to cause both dysentery, and diarrhea. Class, what is the difference between dysentery and diarrhea? Anong difference nilang dalawa? What is the difference between dysentery and diarrhea? So let's first, this is the most common. Anong meron sa diarrhea, class? What does your stool look like?
Loose and watery.
Okay, loose and watery. Okay, you have your loose and watery stool. Very good. How about your dysentery, class? When you have dysentery, what would your stool look like?
Mucus or bloody.
Okay, so your stool is watery with blood and mucus. Now, you may be wondering, sir, how do hospital workers or healthcare workers get infected with this? Now, imagine if you're a healthcare worker. Now, your patient is suffering from dysentery and diarrhea. Now, the patient has to go often to the bathroom. Of course, not all patients are very hygienic. Now, let's say they didn't clean their hands properly after taking a dump. Tumae sila. Hindi sila naghugas ng kamay maayos. They will start touching your bed, their hospital bed, the doorknobs, the tables, and other equipment or materials or supplies in their room. Now, dumating ka, you're the medtech. You have a request to take blood. You'd be touching a lot of stuff. Then ikaw, you don't practice proper PPE, hindi ka nag-gloves. Umarap ka sa patient nang wala kang gloves. Then ikaw naman, kumain ka, may ka magkamay, magkamay, hindi ka naghugas. You could get infected with shigellosis and salmonellosis. Then another one is your tuberculosis. So you have your TB. So again, this is by aerosol transmission. So kapag umarap ka sa patient na hindi mo alam na may TB pala, you have no idea that the patient has TB, you just start coughing, you don't have your respirator or your mask on, you could get infected. Then we have your brucellosis. Now, just to give you a brief background, this is caused by your Brucella species. This is a type of zoonotic. Class, when you say zoonotic, what does it mean? From the word zoo. Zoonotic class.
From animals, sir.
Okay, they are commonly disease of animals. Sakit ng mga hayop. Now, in brucellosis class, this can be found in cows, pigs, dogs, livestock class such as your sheep, goat, even camels. And one of the things I hate, rats. Now, your Brucella class usually infect the most predominant WBC in the body, known as your neutrophil. So neutrophil class, this is the most abundant type of WBC sa body niyo. They infect it by going inside the neutrophil, and they will cause death to that WBC. Now, how does the health worker get infected by Brucella? Now, imagine if you're a veterinarian, you will be handling a dog or a animal infected with Brucella. Now, you could get it via inhalation. So you could inhale yung ano ng aso, like pag nagpapat siya, hinihingal, you could actually inhale aerosols from Brucella. Then another type of mode of infection would be ingestion. You could get infected with brucellosis via ingestion, specifically drinking infected milk. Remember, we have your cows, sheep, and goat. So drinking milk from those animals can lead to your brucellosis. Then the last one would be your hepatitis class. So there are 3 common hepatitis that you'll be encountering in your medtech life. You have your hepatitis A and your hepatitis B and C. Class, how would you get your hepatitis B and C? Based on your knowledge, how would you get infected with hepatitis B and C?
Through body fluid, which is blood or semen, sir.
Okay, so body fluid are also known as your bloodborne transmissions. Bloodborne transmissions. Body fluid exchange. How about your hepatitis A class? How would you get infected with hepatitis A? How would you get infected with your hepatitis A? So your hepatitis B and C can be transmitted via bloodborne transmission, exchange of body fluids, sexual contact. But how about for hepatitis A class?
Sexual intercourse, sir.
No. That's for hepatitis B and C. How about for hepatitis A?
Sa food or contaminated.
Okay, so we have your foodborne. Class, I have a question. Dati ba nung face-to-face kayo, sa labas ba ng San Agustin may mga tindahan ng pagkain? Like yung squid ball, fish ball, kikiam, kwek-kwek, ganyan. Meron?
Yes, sir.
Do you guys often eat there? Sino madalas kumakain doon? Pag kumakain kayo doon, class, let's say umorder kayo ng fish ball or squid ball, then di ba may sausawan, yung sausawan nasa bote? How many times do you dip? Do you dip your food sa sausawan? Okay. Just to give you a story, guys, I want to share to you a story. During my college life, in Manila, we have what you call the Hepa Lane. Hepa Lane, also known as your Hepa Street. So this is a street wherein all type of food vendors are seen. Now, students would often go here. Not only students, but some adults. Imagine Manila is a dirty place. Sobrang dumi niyan kung sino-sinong ano. Now, one of the things, let's say you buy 5 pieces of squid ball. Now, ikaw gusto mo ng masos. You would dip it one time, then kakagat ka. May matitirang 2 piraso. Isasawsaw mo na naman. Now, sa pangalawang sausaw mo, you have your saliva within the stick. Now, your saliva, if you are infected with hepatitis A, your saliva would contain the virus, leading to the transmission or leading to the sauce getting infected with Hepa A. So that's how hepatitis A can be transmitted. So, class, I advise, whenever you're gonna eat out, as much as possible, kung maraming tao na nakikisawsaw dun sa sausawan na yun, just use a different container. Pwede nyo i-request kay Manong or kay Manang na bagong ano na lang, lalagyanan, manghingi kayo ng separate sauce. Okay. Now, you have your common considerations in specimen collection. Now, you have to consider, class, this is very important, adequacy. Amount collected must always be sufficient. Sufficient amount allows repetition of procedure. Class, once you become interns, I want you to remember this. No matter what happens, you will all have to collect specimen that are adequate. Let's say if you're gonna take blood, and nakalagay dun sa tube is 2 ml. You have to get blood to the 2 ml mark. You don't get 1.8, you don't get 3 ml, you get the exact amount, which is 2 ml. Now, the reason for that, class, there will be your rejection. Your specimen will be rejected and papagalitan. Okay? And another one would be your proper site. So, collected at area where infection is suspected using a septic technique. So, let's say the doctor requested for a wound swab on the left ankle. Pero ikaw, ang kinuha mo, right ankle. So, you don't do that. You follow the instruction, specifically where it is suspected, using a septic technique now. Aseptic, class, meaning sterile, meaning clean. Class, based on your order of draw, how would you clean your site for blood culture collection? Paano nyo nililinis, class? Any ideas? How would you clean your site pag pag-collect kayo ng blood for blood culture? So kindly take this down. You clean your area of collection by using alcohol first. Alcohol. Followed by betadine. And then finally is alcohol. Sir, anong meron sa betadine? Bakit ginagamit siya? Now, your betadine can enter your bacteria. Will enter your bacteria and destroy it via inside. Very fast ang effect niya compared sa alcohol. Now, you may be wondering, sir, bakit last yung alcohol again? This is to remove the residue ng betadine. Remember, your betadine is color brown, dark red. So, you don't want seeing that in the you have to remove that via cleaning it again with alcohol. And you also have to consider your proper time. So, collect specimen at the right stage of disease. And then, promptness of examination should be taken immediately to the laboratory and processed instantaneously. So, kasi I want to share to you nung intern ako, meron kaming case wherein hindi dinala ng medtech yung blood. The request was ProTime. ProTime is your coagulation study. So this would use your light blue top. Now, ang ginawa ng ka-intern ko, nilagay niya yung light blue top sa bulsa ng lab gown niya. Sa pagiging forgetful niya, dala-dala niya yung lab gown niya, naiwan niya pala yung dugo doon sa lab gown niya. And na-demerit siya for 1 week. So you have to take notice of that. You have to bring it immediately to the laboratory and process instantaneously. Kasama pa yung request doon sa lab gown din niya. So as much as possible, don't do that, class. If may container kayo, you have your tackle box. Doon nyo ilalagay yung blood niya. Then specimens should be collected before administration of any antibiotics. Class, can you tell me why that is being done? Specimens should be collected before the administration of any antibiotic. What's the reason for that? What happens if you collect the specimen when the patient has already taken antibiotics?
It could give false result, sir.
All right, very good, Miss Hannah. Okay, so this could lead to your false no growth. False no growth. So imagine, class, you took the blood of the patient 2 hours after him taking his antibiotic. Now, remember your antibiotic kills your bacteria. So if you took the blood, wherein the bacteria is already dead, most likely your culture bottle will have no growth. But this is erroneous. This is false no growth. So as much as possible, take it before the administration of any antibiotics. But there is a device that I will discuss later that can allow you to take blood even though the patient has already taken antibiotics. Now, we have your criteria for specimen rejection. So, insufficient information. So, if you receive a sample, imagine, class, this is one of the problems pag naging intern kayo, I want to share to you. You will be receiving specimen pag nasa microbio kayo. It could be sputum, it could be blood, it could be urine. Now, dadalhin yan minsan ng mga nurses from the ward. Sometimes, you would notice no name. Now, example, Juan lang yung nakalagay sa label. But yung request nakalagay, Juan de la Cruz. Would you accept this? Yes or no? Nakalagay sa label ng specimen, Juan. Pero sa request, Juan de la Cruz. Would you accept this?
No, sir.
No, sir.
Okay, you have to reject. The reason for that, class, is the request should match with the label of the specimen. Kasi malay mo pala, Juan Monte pala yan, or Juan other last name, di ba? So that could be a problem. Then, if it is without label, so very important, class, ng label, you have to identify what type of specimen is that, anong kanino, who owns it, kailan kinolect, and improper container. So meron akong nakita, class, one time, it was a funny thing. Dinala ng patient, bumili na, yung ice cream box, yung ice cream container, yung pint, doon niya nilagay yung stool. So hindi pwede yung ganun. You'll be encountering ganyan, may mga ganyan patients. Nilalagay minsan sa bote, nilalagay sa containers. You have to reject those type of cases. And then another one would be your insufficient amount. So sabi ko nga, if the required volume is 2 ml, if the required volume is 5 ml, you have to follow that. Never too much, never too low. But it can be too much depending on the type of test being requested. Kung ang test nyo naman, class, is related naman sa chemistry, okay lang kahit madaming blood. Then, grossly contaminated specimen and dry swabs for culture. So if your sample is urine, and you notice that there are fecal contaminants, you have to reject that. Okay? Then another would be delay in collection and transport in the laboratory. 2 or more specimens, even in different containers, only one must be processed. So let's say your patient's test is for urine culture. Ang sinabit niya, 2 container with urine. Now, you just have to choose one for you to process. But you can actually check the quality of the urine. So if the urine is a bit light, white, or clear, don't choose that. Choose the one that could be yellow, which is somehow very concentrated. And you could have a higher yield of getting a accurate result. Then disposal of rejected specimens must be only done during the following conditions. So you have to inform the doctor. Meron kasing doctor's class na they usually collect very difficult specimens. Let's say synovial fluid, pleural fluid. Now, if you're gonna reject that, you have to talk to the doctor kasi very complicated yung procedure na yun. Invasive procedure yung ginagawa ng doctor. So magagalit sila sa inyo pag late na nilang nalaman na ni-reject mo yung specimen. So your reason should be valid. So pwede mong explain sa doctor, Doc, your sample is insufficient. If I process this, this will yield inaccurate results. Kasi may mga ibang doctor class sasabihin sa inyo na, sige na, i-process mo na yan, kaya mo naman yan, i-process mo na yan, okay na yung amount na yan. You have to be firm. Huwag kayo matatakot sa doctor's class. You have to be firm with your decision to reject. Kasi if there are problems with the result, you're the one who's getting lambasted. Kayo ang mapapagalitan. Then all concerned individuals are notified of the rejection. So if their patient, sample collected by the patient is rejected, inform nyo. Usually naman class sa request, nandun yung contact number ng patient. Even the doctor sometimes. So inform them. Then you have to store the specimen for 48 hours before your rejection. So you have 2 days to inform all required individuals of the rejection. Then you have your specimen collection, so blood culture class. So you must prepare your skin properly with alcohol, betadine, then alcohol. Yun yung sabi ko kanina. Then the most common type of media used for your blood culture is your tryptic soy broth. It is usually collected before fever spike and before antibiotic administration. Now, we have your ARD class. This is the antibiotic removing device. This is usually added sa blood culture nyo to inactivate beta-lactam in antibiotics. Class, beta-lactam, these are a common group of antibiotics used to treat the most common type of infections. Now, your ARD class also inhibits the bactericidal effect of your antibiotics. So even though meron ng antibiotic yung patient, somehow the bacteria collected can still survive. Then you have requires at least 2 blood specimen in a 24-hour period in different sites. So pag request sa inyo ng doctor, you're required to collect blood culture 2 sites. So you could collect one in the left antecubital area. The other one could be in the right. Class, mag-refresh nga tayo ng phlebotomy nyo. What if yung right, ganito, let's say na 2 sites ang kailangan, pero amputated yung right arm ng patient. Saan ka pwedeng kumuha? What could be your second site? So ang first site mo, left arm. Pero yung right arm ng patient amputated. Saan ka pwedeng kumuha? So wala siyang arm class. As in amputated yung buong arm niya. Where would you collect? Saan ba ang mga blood sites niyo, class? Blood puncture sites niyo sa phlebotomy niyo? Saan kayo magko-collect? Come on. Try nyo, class. Any ideas?
Sa paa, sir.
Okay, very good. Sa paa. You could get it in the feet, but you have to ask the patient for a certain disease. Kailan ka hindi pwedeng? When are you not allowed to get blood sa feet, class? Or sa legs? When? Anong sakit ng patient? If the patient is what?
Diabetic, sir.
Alright, very good. Both of you, very good. It's your diabetic. So if the patient is diabetic, class, you're not allowed to take blood sa feet. Remember, class, ang diabetes nyo, one of the effects of diabetes is you have what we call slow healing. Slow healing. And one of the parts wherein sobrang slow ng ng sugat will be sa feet. That's why yung mga patients na diabetic, class, if you notice, yung paa nila, minsan pag may sugat, hindi na agad-agad gumagaling. So yun. So you have to ask first if the patient is diabetic. Another site would be in the hands. So dito. In the hands. Okay? So hindi pwede sa feet, you could actually try dito sa hands. And then the ratio of your blood to your tryptic soy broth or your culture media in adults is 5:10, while the ratio of blood to culture media in neonates is 1:10. Blood culture are kept for 7 days routinely before reporting no growth. But sometimes, class, depending on the laboratory, 5 days are already enough for you to report no growth. But routinely, it is 7 days. Now you have your signs of growth, turbidity, hemolysis, clot or pellicle formation, bubbles, and colonies on top of blood layer. Let's focus on this, bubbles. Plus, how are bubbles formed? How are bubbles formed? I'm not talking about the blood culture bottle. In your experience, how would you form bubbles?
May air, sir.
Okay, so you have your gas. Very good. Now, certain bacteria, class, which we will discuss in the midterm, certain bacteria, specifically the enterics, some enterics, can produce gas. Now, remember, when there is gas in a liquid solution, there will be bubbles. So that's one of the signs of growth. And turbidity, so the more turbid the blood culture the bottle, the more or higher the rate of growth there is. Then there could also be hemolysis. So the hemolysis refers to the destruction of your RBC. Clump or pellicle formation. So there are clumps formed in the blood culture bottle. Then colonies on top of the blood layer. So here is an example class of the different blood culture bottle. Now the most common type you'll be encountering is your BD backpack. Sorry. Now, Dickinson. This is a company that produces your backpack bottles or your blood culture tubes. Mas pasensya na kayo ha. I've been lecturing kasi since early morning, every day, almost every day. Kaya yung lalamunan ko, parang ano na. So I apologize for that. So this is a type of blood culture bottle, your BD backpack bottle. Then we have your SPS, or also known as your sodium polyethanol sulfonate, at a concentration of 0.025 to 0.05. Class, in your order of draw, let's recall your order of draw. What's the first tube that you will be using in your order of draw? What's the first tube in your order of draw, class? Okay, yes, that's actually correct. It's light blue. But let's consider na isama nyo yung may request si doctor na micro. What?
Blood culture.
Okay, so what's the color of the tube for your blood culture?
White, sir.
No, it's not.
Yellow.
It's yellow. So what is the anticoagulant of your yellow? Anong additive ang laman ng yellow? Your yellow contains what?
SPS.
Alright, it's this one. Ayan siya. So it contains your sodium polyethanol sulfonate. Okay. So your SPS class has a concentration of 0.025 to 0.05%. Now this is your best anticoagulant for blood culture. It is anti-complementary. Class, in your immunology serology, complement is wherein antibodies would bind to foreign substances, specifically your bacteria. And after binding, they will destroy it. So yung SPS nyo class, anti-complementary, meaning he blocks or decreases the effect of your complement, allowing your bacteria to survive. Then, can you tell me class the meaning of phagocytosis? What does phagocytosis mean? Phagocytosis class. Phagocytosis.
Cell eating, sir.
Alright, very good. It's your cell eating. So here in this case, this involves your WBC class. Now, your WBC, whenever they find foreign substances, specifically bacteria, they would phagocyte that. They would ingest, kakainin nila. Now, your SPS are antiphagocytic. So again, the SPS will prohibit this action from happening. Then it also inactivates aminoglycosides. So this is again another group of antibiotic. Then it inhibits or neutralizes the bactericidal effect of your human serum. Remember class, your human serum contains antibodies. So in-neutralize na yung antibodies to prevent them from attacking the bacteria. Okay, so that's how your SPS works. Then it inhibits the following bacteria class. So hindi pwede ang SPS sa mga sumusunod na bacteria. Sa Neisseria, sa Gardnerella vaginalis, sa Streptobacillus moniliformis, and sa Streptococcus. Hindi pwede ang SPS sa mga yan. They are being inhibited. Next, we have your throat and nasopharyngeal culture. So after your blood culture is your throat and nasopharyngeal culture. They are usually collected on a cotton tip applicator and applied to a slide of culture medium. Now class, the normal flora sa bibig nyo, in your throat and your nasopharyngeal area is your alpha hemolytic strep. This is also known as your S. agalactiae. Streptococcus Agalactiae. Streptococcus agalactiae. While your Streptococcus pyogenes class, this is the pathologic Streptococcus, the one that can cause diseases, the one that can cause pneumonia. Then you have your sputum culture. So you usually collect this through deep cough and requires at least 5 ml for culture. For MTB culture class, you would be using two types of reagent. You would be using N-acetyl-L-cysteine for digestion and 2% sodium hydroxide for decontamination. So let me explain this class. Remember class, the sample you'd be using on this is your sputum. Now, ang plema nyo is usually sticky. It is sticky. It is tough. And it is very, very thick. Now, with the use of your N-acetyl-L-cysteine, also known as your NALC, N-acetyl-L-cysteine, also known as your NALC, your NALC will digest this, making it loose, and making it thin. So, padali na siyang process. Then, you will be adding sodium hydroxide for decontamination. Now, decontamination class, you would be killing other bacteria. So you want to specifically grow TB lang. So you don't want your alpha hemolytic strep or S. agalactiae being present in your culture. So you only want TB. So you add sodium hydroxide for decontamination. Then acceptable specimen upon microscopic view should have the following: 10% epithelial cells per low power field and greater than 25 PMN. So when you say PMN class, these are cells that are polymorphonuclear. Sir, what cells are this? These are your WBCs class. Polymorphonuclear cells are your WBCs. So it should have less than 10% epithelial cells and greater than 25 polymorphonuclear cells per low power field. Okay. And then here's an example class of the swab. So this is a swab. This is another swab. And then I'd like you to take note of this. Your Kerry-Blair. Now your Kerry-Blair class swab is a type of transport swab that is used for rectal swabbing and fecal matter. So again, this is a transport swab used for your rectal swab and your fecal matter. Okay. Transport medium swab for your stool and rectal swab. Okay, normally class, using your cotton tip swab, you'd be swabbing at the back of the uvula, at the back of the throat. So dito. So for a better appreciation, I'll show you this. So this is your uvula. Now you're going to swab here, right here. Diyan kayo magsaswab sa likod. You're not gonna swab here. You're not gonna swab here. The reason for that is you're just gonna get the normal flora or epithelial cells. Now, class, I'd like you to take note of this picture. One of the infections, class, if you know someone that has a very white tongue, as in puting-puting ang dila, then there are patches of white. Your friend is most likely could have bad breath. This is your pus, class, nana yung mga puting-puting yan. So this is your pus is a combination of your WBC and bacteria. So kadiri, no? Imagine if you're gonna something like that. Okay. Class, sino na dito na swab for COVID? Sino na swab dito for COVID testing? Yes. Can you share to me your experiences? Dean and 3 more people, or just 2 people? Si Dean, who else? Dean, can you share to me anong naramdaman mo sa first swab mo? Nung ini-swab ka?
Sa swabbing, sir, ay yung sa oral na swab, sir, wala masyado. Pero yung sa nasal na, sir, though,
Sakit?
kasakit.
Yung weirdo. Okay. Hindi naman nagdugo.
Hindi naman.
Okay, so it's a sign na hindi marunong yung nag-swab sa'yo. At least okay lang yan. First experience. How about the rest? Sino yung isa pa? Si Andrea? Was it yung Miss Bayoging? Sino pa yung na...
Wala kayo nag-raise, sir?
Okay. Sino yung mga nag-raise ng hand? Sorry, hindi ko nakita eh. Grass, yes.
Ako sir, isang nag-UTI ko sir, kay like, pila na ka-days, ang akong fever bala, so, abi naman. COVID, so ginpatas for COVID-19, sir. Through nasals, sa nasal nga swab bala, sir. Itong okay mo siya, sir. Though, dancing mo lang, passing discomfort mo lang. Then,
Sobrang sakit ba nung ano ka? Ini-swab ka sa nose? Hindi naman.
hindi naman, sir. Just slight discomfort lang, and then, wala naman din yun.
Pero your UTI is already treated, I guess.
Sir.
Okay, that's good. Pag whenever you feel na ganyan, you just drink coconut water, coconut juice, then that's a fluid para ma-flush out yung mga ano. Then who else, aside from Grass and Dean? Sino pa yun? Nag-raise ng hand? How was your experience, class, in your COVID swabbing? Excuse me. Okay, so I'm going to show you, class, how it should be done. Now, here's your nose. This is your nasal cavity. Now, your target area, whenever you're going to perform nasal swabbing, is this. Now, if you're ever going to do your swabbing, you shouldn't be too fast to the point na pati itong area na ito matatamaan nyo. And you should consider having the patient tilt para to avoid matamaan yung surfaces. Then, you have to hit, whenever you felt or feel na meron ng resistance, then you swab. That's the part, dito na siya banda. Now, if you push too hard, napasobra ka ng pasok, it's really gonna hurt. To those who experience pain, yun, napasobra yung tusok ng swabber nyo. Okay? And then another one will be your urine collection. So you're going to collect it via midstream clean catch or suprapubic aspiration. So I'll show you later how suprapubic aspiration is done. Then culture should be done within 2 hours after collection, stored or refrigerated at 4 degrees for 24 hours. Colony count of 1 times 10 raised to the 5 colony forming unit indicates your UTI. So this will be discussed in your lecture class. Then we have your stool culture, no contamination of urine. Collect during early phase of the disease before administration of antibiotic. 1 to 2 grams of stool is sufficient. Store at 2 to 8 degrees if not processed immediately. So class, whenever you see the 2 to 8 degrees, this refers to your refrigerator. Ref temp yan. So this is how your suprapubic aspiration, class. So using a syringe and a needle, you're going to perform at a 20-degree angle. Then you're gonna perform puncture till you reach the urine in the blood. Normally, doctors are the one doing this. So using a syringe and needle and a 20-degree angle, you will puncture until you reach the urine in the bladder. Normally, class, yung suprapubic aspiration nyo, suprapubic aspiration nyo is usually done on cases wherein hindi malagyan ng catheter, no catheter. So, pwede ito sa mga bata, usually seen in kids, and can happen also in adults on varying conditions. Then we have your genital culture. So, the most common type is your Neisseria species. So, sa genital culture class, you're going to use a type of swab wherein you're going to swab the genital area of the person. Now, the most common type of bacteria will be your Neisseria. But you have to consider, class, Neisseria species is inhibited by fatty acids and salts. So, sir, anong meron sa fatty acids and salts? Now, remember, you're using cotton swabs. Now, your cotton contains fatty acids and salts. So, if you use cotton, you could inhibit Neisseria species. So, what you're going to use now is a type of swab known as your Dacron, rayon, and polyester tip swabs. So this is a type of chemical, or rather a type of solid that is attached to swabs, and this is the one being recommended. So whenever you hear Dacron, rayon, and polyester, this is the one used for your Neisseria. Then we have your cerebrospinal fluid. Now, you're required to produce at least 3 to 10 ml of CSF and can be done by physicians. CSF is to be processed immediately. If delayed, it must be stored in an incubator. So class, whenever you encounter CSF at tinanong kayo kung saan i-store, it's at your incubator. Now, most incubators have a temperature of 37 degrees centigrade. They do not refrigerate CSF. Remember, sa incubator siya. Then, if the doctor is going to collect CSF, it has to be collected in 3 tubes. 1 for chemistry and serology, 2 for micro, 3 for hema. Now, if you recall, sa order of draw nyo, laging first ang micro. But in this case, second ang micro class. Now, the reason for that is you want to avoid getting it contaminated. Kasi remember, you'll be collecting CSF. So usually CSF is collected by a lumbar puncture. So you get to have contaminants sa skin, and you don't want that. Okay? So you want the second tube to be micro para walang contamination. So this is how the genital swabbing is done. So using the polyester or the Dacron or rayon tip swab, you're going to insert it till you reach the uterus. Then upon that, you're going to slowly twist it till you reach the outside. Then you're going to make a smear. Then yung smear na yung class, that's the one you're going to use for your analysis. Then these are the normal flora. So I think I posted this sa handouts. So for the skin, we have your staph, micrococcus, etc. For your oral cavity, we have your strep, Neisseria. For your large intestine, we have your Bacteroides, Clostridium. Genital tract, Lactobacillus, and so on. Urinary tract, we have your staph and your strep. And the normal sterile sites are the following: all internal organs except your appendix and large intestine, body fluids, blood, and urine in bladder, ureter, and kidneys. So let's have your class participation. I have here problems. Now, your patient test is for MTB culture. Patient submitted is 1 ml of sputum specimen.